Okay, so you are doing it, yes? Okay, so the next topic that you are going to study, it is arthrosyndesmology. 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 So, logy, you know, it is like teaching, yes? And arthro is these are joints, and syndesmoid is also like type of bone junctions. So, arthrosyndesmology is a part of anatomy that studies bone junctions, connections between bones. Bone junctions. So all the bone junctions are divided into 3 groups. So first group, these are non-synovial joints. Non-synovial joints. Or its other name, it is synarthrosis. Synarthrosis. Or also we can name them immobile joints. Immobile joints. So it is more ancient type of joints. Like during evolution, they appeared earlier than the other type. So that's okay. Later we'll talk about it. The other type, these are synovial joints. Synovial joints. The other name of synovial joints, these are diarthrosis. Diarthrosis. Or they are also mobile joints. Or we can also name them cavitated joints. Or interrupted. So there are very many names of these joints. So this is like later, they were formed later during evolution. Yes, and they are mobile. And there is also transitional form between synarthrosis and diarthrosis. These are hemiarthrosis. Hemiarthrosis. Actually, when you start reading books in English, потише, пожалуйста, товарищи. Спасибо. When you start reading books in English, you will find that there is no such a term. But there is a term, the symphysis. Yes, symphysis. So we cannot refer these joints to immobile joints because they are actually slightly mobile. But we cannot also consider them as synovial joints because they don't have 3 main features of synovial joints. So we'll start with main features of synovial joints. They are 3 or main structures, yes? If they are present in the joint, all 3, yes, then it means that this joint is synovial joint. So main features. So first, okay, I will remove it. So first, what is a joint? Yes. Like a diagram, that's a scheme. This is a joint. This is a joint. So first main feature that must be present in any synovial joint, these are articular surfaces. Articular surfaces. So articular surfaces are the surfaces of the bone, which face each other to form the joint. Yes? So this is one articular surface, this is another articular surface. Number of articular surfaces in the joint should be not less than 2. Yes? At least 2. So if in the joint there are 2 articular surfaces, such a joint is considered to be simple joint. Like shoulder joint, we, for example, can say that is formed by glenoid curvature of scapula and head of humerus. It is simple joint. Yes. there are more than two articular surfaces, then such a joint is considered to be compound joint. Like, for example, elbow joint that includes in itself humeral ulna, humeral radial, and proximal radial ulnar joints. So totally there are 3 simple joints here, and totally there are 6 articular surfaces. So it is compound joint. So articular surface cannot be one, yes, because if there is only one articular surface, it does not articulate with anything, so certainly it is not a joint, yes. So the second main feature of synovial joint is articular cavity. Articular cavity. Articular cavity. So articular cavity is a space between articular surfaces. Here, yes? That's it. This is articular cavity. So presence of articular cavity makes a joint to be mobile. Because if the bones would fuse with each other without any cavity, certainly movement would be impossible. Yes, it's obvious. And the third point, the third main structure of synovial joints, this one, that is articular capsule. Articular capsule. So articular capsule is a connective tissue structure that separates articular cavity from all the other structures of human body. So articular capsule is usually attached to the margins, to the edges of articular surfaces. So like this, yes, that's it. And in articular capsule, 2 layers are distinguished. So this layer, external layer, is named fibrous layer. This is fibrous layer. It's just formed by connective tissue, and it serves for the protection. Fibrous layer. There is internal layer that is named synovial muscle. Synovial layer. Synovial layer aligns articular surface. Yes, this is synovial layer. It covers articular surfaces. And it is formed by special cells, yes, synoviocytes, and these cells produce synovial fluid. Here, articular cavity is not empty, yes? It is filled in with synovial fluid. So, filled in with synovial fluid. Synovial fluid. Synovial fluid prevents friction of articular surfaces with each other, yes? So, if the synovial fluid would be absent, in some cases, amount of synovial fluid decreases or it totally disappears, then movement becomes impossible. So, articular surfaces, friction of articular surfaces with each other starts, yes, and they start being destroyed. So it is a disease. Yes, finally there will be ankylosis. Ankylosis is such a pathology, the absence of movement in the joint. So these are 3 main features of synovial joint. If they are present, the joint is synovial. If they are absent, the joint is non-synovial. So non-synovial joint, it is a connection by any type of connective tissue without any interruptions. Like, there is no articular cavity, yes? So like there is one bone, another bone, and so this non-synovial joint, like ligament for example, it is an example of non-synovial joint, starts from one bone, goes to another bone, and that's it. Certainly, ligaments for example, they have a slight elasticity. Потише, пожалуйста, товарищ. But it's not endless. Yes, so that's why movement is nearly absent in non-synovial joints. So what do you have to know? This a classification of non-synovial joints or synarthrosis. Non-synovial joints are classified according to the type of connective tissue that forms them. So first of all, there are syndesmoses. Syndesmoses. So syn it is like with, yes, and desmo means proper connective tissue. Proper connective tissue. So these are non-synovial joints which are formed by proper connective tissue. And so, for example, these are ligaments, then membranes. Membranes are broad ligaments. Like when you studied bones, yes, you studied that in radius and ulna, for example, there are interosseous borders, yes? And between these interosseous borders of radius and ulna, interosseous membrane is stretched, so it is just a broad ligament. These are membranes. Then there are sutures. They are between bones of skull, for example, yes? There are fontanelles. So these are fontanelles are connections between bones of the skull which are present in newborns. Yes? Like this frontal, occipital, and so on. So these are syndesmoses, non-synovial joints which are formed by proper connective tissue. If non-synovial joint is formed by cartilaginous tissue, then it is synchondrosis. Synchondrosis. Chondra in Greek, it is cartilage. So synchondrosis are divided into two groups: temporary and permanent. Temporary synchondrosis are those which exist up to the definite period of life, up to a definite age. Yes, like example of temporary synchondrosis, we can say, is located in the region of acetabular. Yes, when we studied hip bone, we will say that it consists of three parts. Yes, ilium, ischium, and pubis. And up to the age of 18 years, these three bones are not connected with each other. Yes, there is synchondrosis. But at the age of 18, these three bones fuse together into a single bone. And this temporary synchondrosis is substituted by synastosis. So cartilaginous tissue gets transformed into bony tissue. Yes, in this case. Permanent synchondrosis is that one which exists for the whole life. An example of permanent synchondrosis we can see, for example, at the region of foramen lacerum. Foramen lacerum is here. It is located in the place of connection between basilar part of occipital bone, body of sphenoid bone, and apex of petrous part of temporal bone. So, superior part is opened because here internal opening of carotid canal passes, yes? But inferior part of this foramen is closed by sphena tempora occipital synchondrosis. So it is permanent. So it exists till the end of the life. Okay. So if synarthrosis or non-synovial joint is formed by bony tissue, then it is named synostosis. Synostosis. Osteo means bone, we know it, yes? Osteology is a part of anatomy that studies bones. There is also, and for example, we can see synostosis. And so, for example, synostosis we can see here at the region of acetabulum also at the age of 18, yes? We also can see, we cannot see, but it is present the synostosis in the middle of the frontal bone. Yes, because we know that in newborns, frontal bone consists of two parts. Yes, and it should get fused after a short time. Yes, at the museum when we went there last week, we saw, even here we can see, that sometimes synostosis is not formed completely, and sometimes in some people still syndesmosis is present. Yes, this is huge. It is a type of syndesmosis. It is metopic huge between two halves of frontal bone. There is such a rare type of non-synovial joints that is formed by muscular tissue, and it is named synsarcosis. Sarco means muscle, yes, in Greek. Sarcoma, it is a malignant tumor formed by muscular tissue. So synsarcosis is present, for example, between scapula and bones of the trunk. When we studied the bones of upper limbs, we were saying that all the bones of upper limbs are divided into bones of shoulder girdle and bones of free upper limb. And we also were saying that bones of shoulder girdle as well as bones of pelvic girdle, they are directly attached to bones of the trunk. And in clavicle it is definitely so. Yes, so there is sternoclavicular joint that is between clavicular notch of sternum and sternal end of the clavicle. We'll study it later. But in the scapula, we didn't find such a joint. But scapula, is surrounded by numerous muscles which originate from the bones of the trunk, and they are inserted to the scapula. So that we can say that scapula is connected with bones of the trunk by means of synsarcosis, such a muscular, like non-synovial joint that is formed by muscular tissue. Okay. And one more, like an exception, that is such type of joints is present only between dental alveoli and the teeth. It is gymphosis. It is present only between dental alveolus and the teeth. Yes. So that is a classification of non-synovial joints. Now again, let's go back to synovial joints. So when you talk about non-synovial joints, you should just say name in English and in Latin, show the synarthrosis, yes? Tell us where it starts and where it ends, and that is all. But when you describe synovial joints, you should describe it according to a plan. According to the plan. Now I will tell you about plan of synovial joints description. Okay. So first, you should say certainly name as always. Yes, name in English and name in Latin. Then you should tell about articular surfaces. So yes, this manual Arthrosyndesmology is also available at our library. It is also present in PDF version in that file which I sent you in chat and VK. You can use another sources, but plan is given in that book if you need it. So I hope that soon you will get library card and you will go and get all the textbooks in paper variant. Okay, so articular surfaces. For example, if we talk about shoulder joint, yes, we are saying shoulder joint, articulatio humeri, and we are saying that it is formed by glenoid cavity of scapula and head of the humerus. Then you should give general characteristics of this joint. General characteristics. Okay, first you should say if the joint is simple or simple or compound. We have already said about it, yes? If it has two articular surfaces and in shoulder joint they are two, yes, it is simple. If they are more than two, then it is compound. Second, you should see if joint is complex or not. Complex or not. To understand if the joint is complex or not, now we should discuss accessory structures of synovial joint. Accessory structures of synovial joint. So main structures we have already described. Yes, main structures should be present in each of the synovial joints. Accessory structures, they can be present and can be absent. So it's not compulsory. That's why they are accessory structures. Yes. So first, accessory structure, it is articular lip. Articular lip. Or labrum. It is Latin labrum. So articular lip, it is a structure that is formed by cartilaginous tissue, and it looks like a circumference, and it like complements articular surface. One of the articular surfaces to increase contact area of articular surfaces. For example, articular lip is present in the shoulder joint. How does it work? So if you look very attentively, you will see that glenoid cavity of scapula is very small in comparison with the head of humerus. Yes? And so that's why actually shoulder joint is the leader in the frequency of dislocations. Do you understand what is dislocation?
Yes, ma'am. The articulation is opened up, the bone gets replaced with the
yes.
joint.
When articular surface like articular head goes away somewhere from the articular fossa. Yes? Range of movements inside joints is very small. Yes? And any excessive movement causes dislocation. And that's why here in the glenoid cavity there is articular labrum. It is attached to the margins of articular surfaces. So this is what is it? Frontal section. Yes. If you make sagittal section, we will see like this. This is glenoid cavity, and this is glenoid labrum. Yes. So to increase contact area. So if it slightly increases contact areas, and that's why range of movements in shoulder joint is not that much small. Yes. But still, frequency of dislocations in shoulder joint is very high. The same structure, so here it is named glenoid labrum. Glenoid labrum. The same structure, articular lip, is present in the hip joint because acetabulum is also much smaller than the head of femur. Yes, and that's why here there is acetabular labrum. Labrum acetabularis. Okay, this is the first. The second accessory structure is articular disc. Or meniscus. So articular disc is also cartilaginous structure. It is also formed by cartilage, but it is located between two articular surfaces. So sometimes in some joints, articular surfaces don't fit each other. Yes, they do not correspond each other. Like shape of one articular surface does not coincide with the shape of another articular surface. Such articular surfaces are considered to be incongruent. Алло. Да, у меня занятие. Так, хорошо, ладно. Incongruent. To make them congruent in this joints, there are discs, like there are cartilaginous plates, which make articular surfaces to fit each other. Yes. in case when this cartilaginous plate totally divides articular cavity into two floors, into upper and lower floor, like this, yes, this is articular disc. This structure increases range of movements, yes, because now they can slide around each other, yes, glide around each other. If this cartilaginous plates do not separate articular cavity completely, like for example in case of the knee joint, yes, in case of the knee joint it is like this, like there is communication. Then these are menisci. So singular it is meniscus, and plural it is menisci. So if they are two and they are two, so it's like medial, yes, they are menisci. So this menisci or disc, yes, they serve also to provide congruency of articular surfaces and to increase range of movements in the joint. This third one, yes. And so if synovial joint contains articular disc or meniscus, it is considered to be complex only if there is articular disc or meniscus. Presence of any other accessory structures in synovial joint doesn't make it to be complex. Yes, only presence of articular disc or meniscus. So the third one. The third one, this is synovial bursa and synovial fold. Synovial fold. So usually, as we have already said, articular capsule is attached to the edges of articular surfaces, but not always. So sometimes it forms like folds or bursae, yes, like protrusions outward or inward. So if this protrusion of articular capsule is directed outward, then it is bursa. If this protrusion is directed inward, then it is fold. This is fold. So it means that articular capsule is not firmly attached to edges, yes? First of all, it increases range of movements in the joint, yes? So they are more mobile. Articular surfaces are more mobile in relation to each other. But also, usually these bursae and folds are formed because behind them, like outside, there is any structure. And to decrease friction of this, for example, it is muscular tendon usually, or maybe neurovascular bundle. So to decrease friction also during movement, these bursae are present. So these are two functions, to increase range of movements and to decrease friction. Okay. And the last one, accessory structure, these are intra-articular ligaments. Intra-articular ligaments. So joint, synovial joint, I mean. In Latin it will be articulatio. So intra means inside. Articular means joint, yes? So ligaments which are located inside the joint, inside the articular cavity. All the joints have extra-articular ligaments, which are located outside of the articular cavity, like one ligament, another maybe from the anterior side, to reinforce articular capsule, for better protection, yes? But some joints, they have intra-articular ligaments, which start from one articular surface and go to another articular surface. These are intra-articular ligaments. They serve to restrict range of movements in the joint. Because I told you, ligaments are not that much elastic, yes? And when articular surface starts moving around another articular surface, yes, it is possible up to some extent, yes, because, for example, how will we do it? Like this, yes. So it is possible up to definite extent. It cannot move further because ligament cannot stretch too much, yes? It cannot be overstretched. Otherwise there will be trauma, injury, yes? So these intra-articular ligaments, they decrease range of movements and decrease frequency of dislocations in that way. Okay, so these are accessory structures. We also have to memorize them. And so C, the third point, general characteristics of the joints, you should say whether this joint is combined or not. If it is combined, you should say with which other joint it is combined. So combined joints are those joints which are anatomically separated, so they are located in different articular capsules, yes, but their movement is possible only simultaneously, so they work simultaneously. Like, for example, right and left temporomandibular joint, yes? They are located very far from each other. They have separated articular capsules, but when we speak, eat, when we perform any action with the mandible, movement with the mandible, yes, both temporomandibular joints are in the movement, yes? So temporomandibular joints are combined, we can say. Okay, so these three are general characteristics. Then, fourth point, you should tell about shape of articular surfaces. Fourth, it is shape of articular surfaces. Articular surfaces. Shape of articular surfaces, it can be many. There are ball and socket or spheroidal, yes, there are flat, there are condylar, and so on. You will study it, but shape of articular surfaces will affect range of movements. So you should classify the joint according to the number of axes. So totally, they are three. Now we should understand what are the axes. What are the axes? So they are three. Previously, we have already studied planes, yes? And there are three perpendicular to each other planes. So first, there is a plane that is parallel to the blackboard. It is frontal plane, yes? There is plane that is parallel to the floor. It is horizontal plane. Somehow this way, yes. And there is also plane that is parallel to the wall, yes, it is sagittal plane. Sagittal plane. Somehow this way. Okay, fine. And there are three also perpendicular to each other axes. So, first this axis, that is, this, let's say so, it will be x, yes, x. So this axis is known as frontal axis also. Frontal. This is frontal axis. we are trying to imagine movement around any of the axes, we should imagine a cylinder, like, or a thread, for example, thread that is attached to this axis. And that's how we should imagine which movements around the axis are possible. Yes. So around frontal axis, when we conduct the axis through the center of the joint, now we will understand that around frontal axis, yes, flexion and extension is possible. Flexion and extension. Frontal axis, flexion and extension. There is another axis that is perpendicular to the frontal and like the plane. It is sagittal axis, yes? So this one, that, it is sagittal axis. Sagittal axis. So when we imagine movements which are possible around sagittal axis, also we should imagine such type of movements. And if we, for example, look at the upper limb also, we conduct the axis through the center of the joint. And these are movements around sagittal axis, yes? These are movements around frontal axis, flexion and extension. This is around sagittal axis. Around sagittal axis, movements are named abduction and adduction. So when you move the limb away from the trunk, it will be abduction. Yes, abduction. Because ab means from. Yes. And when you move it towards the trunk, it is adduction. Ad means to. Yes. Abduction and adduction. It's about sagittal axis. And there is another third axis which is perpendicular to the first two. So frontal and sagittal, we can name them horizontal axes, yes, horizontal. And this one that is perpendicular to the others, it is vertical axis, this Y, it is vertical axis. Vertical axis. When we studied planes, two of them were vertical, yes, frontal and sagittal, and only one was horizontal. When we study axis, now two of them are horizontal, and only one is vertical. So again, we should imagine movement that is possible around this axis. Yes, so that's it. Yes, that is the movement. So if we look here in the room, here it is impossible, but so this movement is named rotation. Rotation. But rotation can be directed to two sides, yes? It can be rotation outward or lateral rotation, and it can be directed inwards. It will be medial rotation. So for this, there are special terms. Rotation outward is named supination. Supination. And rotation inward, it is pronation. So it's like supine and prone position, yes? Like supine position when person lies on the back, yes? Prone position when he lies on the abdomen, yes? So supination is rotation outward, and pronation is rotation inward. In some joints, not in some, but in many very mobile joints, movement around all the axes simultaneously is also possible. Like for example in shoulder joint, this movement, yes? It is simultaneous movement around all the axes. Such a movement is named circumduction. Circumduction. These are movements. And now, you should classify joint according to the number of axes. If movement is possible only around one axis. It doesn't matter around which axis it is possible. Such a joint will be uniaxial. Uniaxial. Uni means one. Yes? If movements in the joint are possible around two axes, it will be biaxial. Bi means two. Yes? Biaxial. And if movement is possible around all three axes, then it will be multi-axial. Because ancient scientists, they couldn't count more than two. And three, it was too many for them. Yes? So multi-axial. If movement is possible around all the three axes. And so I told you, range of movements will always depend on the shape of articular surfaces. So for uniaxial, for example, joint can be hinge, it can be pivot, and it can be cochlear. For biaxial, it will be condylar, ellipsoid, and saddle. It's written in the book. And for multi-axial, it will be spheroidal, cotyloid, and plane. That's what we will also study. Okay, so shape of articular surfaces, number of axes, and certainly here in this point you should describe which exactly movements are possible. And then you should say about accessory structures, if they are present, accessory structures. And then you should say about extra articular ligaments which reinforce articular capsule. Extra articular ligaments. So that is the plan of description of synovial joint. This symphysis, for example, pubic symphysis, why cannot we consider it to be non-synovial or synovial joint? Because pubic symphysis is formed by cartilaginous tissue. It is located between two symphysial surfaces of the hip bone. But here, inside this cartilaginous tissue, there is a space, like cavity. But this cavity is inside the cartilage, yes? It's not between two articular surfaces. So that's why, due to the presence of this cavity, passive movement is possible, especially during childbirth, yes, in females. When head of the fetus passes through the pelvis, head is the largest part of the fetus, yes? And sometimes it is too big, and that's why it presses, like it tries to dilate this aperture, yes, superior pelvic aperture. And slight movement in this pubic symphysis is possible. But usually it is immobile, yes. So that's it. So cavity is present, but it is not between two articular surfaces. So that's why it is neither synovial joint nor non-synovial, yes? Okay. Any questions up to here? No questions. Okay. Now I must show you preparation. What are you going to study for the next lesson? So please, take it back out. Yes, take it out. The back. And put